Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about hypertension. Hypertension or low blood pressure is a blood pressure that is lower than normal or expected blood pressure for each person in certain conditions, and it is a relative term. To determine hypertension, we must first determine the value of normal blood pressure for that person, taking into consideration the activity, age, medications and health. To understand hypertension, we must first understand what is blood pressure. Blood pressure is the force with which the blood pushes the walls of the arteries. Blood pressure is read by two numbers. The first is higher systolic blood pressure and the second is a lower diastolic blood pressure. Systolic blood pressure is the pressure in the arteries at the time when the heart is charging arteries with blood. Diastolic blood pressure is the pressure in the arteries when the heart rests. Reading of blood pressure is in millimeters of mercury or Hg. Optimal blood pressure in healthy persons is 128th millimeter Hg. Low blood pressure or hypertension is blood pressure that is below 90/60th millimeter Hg, and that blood pressure is causing problems. Some people always have hypertension, but this is normal for them, and does not cause them any problems. Symptoms of hypertension. Persistent low blood pressure almost never causes serious health disorders because the body adapts on him and do not show any symptoms. The problem arises when a sudden hypertension happens, when the brain and other vital organs lose their blood supply, and do not have time to adjust. In the event of a sudden drop of blood pressure, patients feel fatigue, dizziness, insomnia, depression, disturbance of vision, lack of concentration, lightheadedness, dehydration, syncope, nausea, feelings of severe palpitations, shallow breathing, sweating and others, depending on which hypertension we are spoken about. Primary hypertension. Primary hypertension is a permanent low pressure for which we cannot find the cause, but genetic factors have an impact. Geographic area, nutrition, stress, physical activity and body weight. Primary hypertension is also called idiopathic hypertension, essential hypertension or constitutional hypertension. Primary hypertension is the most frequent among young and slim women, but it is harmless, and can help with diseases, which are caused by high blood pressure, such as hardening of the arteries, myocardial infarction, stroke and others. Secondary hypertension. Secondary hypertension is low blood pressure caused by bleeding, dehydration, infection, heart attack, heart rhythm disturbances, pericarditis, arrhythmia, pregnancy, allergic reaction, stroke, shock, anxiety, hypovolemia, hyponatremia, Parkinson's disease, dialysis, burns, spinal cord injury, diabetes and the introduction of certain medications such as medicines for depression and insomnia, medications used for regulation of cardiac arrhythmia, medicines used for regulation of hypertension, diuretics, beta blockers and others. Orthostatic hypertension. Orthostatic hypertension or postural hypertension is low blood pressure occurring after taking a standing position or stretching. Orthostatic hypertension may occur in any patient. It is due to withdrawal of blood to the lower body during quick standing up or stretching. Orthostatic hypertension is caused by gravity, as it tends to go to lower limbs and puts pressure on veins, causing decreased blood flow and lower blood pressure. Orthostatic hypertension, which is caused by the disease, condition or certain drugs, is called a secondary orthostatic hypertension. Idiopathic orthostatic hypertension is orthostatic hypertension which we cannot determine the origin, and is often an indicator of functional disorders in certain parts of the nervous system. Postprandial hypertension. Postprandial hypertension is low blood pressure that occurs in some people after eating. Postprandial hypertension occurs more frequently in elderly people with high blood pressure and elderly people with disorders of the nervous system. Postprandial hypertension occurs after meals because the blood flow to the abdominal organs during digestion, which leads to a reduction in the amount of blood the rest of the body and low blood pressure. People with postprandial hypertension should not use antihypertensives before meals, and after meals should lie down. Ingestion of high carbohydrate foods may aggravate postprandial hypertension. The diagnosis of hypertension. First, we need to determine whether the conditions for secondary hypertension, such as illness or medication that cause secondary hypertension. After reviewing the entire body, it is necessary to repeatedly measure blood pressure and heart frequency in lying, sitting and standing position. Laboratory tests for hypertension are reduced to a complete blood count, blood glucose and renal function. After that, it is recommended to measure blood pressure over a long period of 24 to 48 hours, during daily activities, with the help of the Holter blood pressure monitor. In addition to these tests, ECG can be used for monitoring of the heart rate, echocardiogram, stress test and others. Treatment for hypertension. Treatment for hypertension is not required if the low blood pressure do not cause any symptoms and reduced quality of life. Treatment for hypertension is associated with diet and increased salt intake. Getting up from lying down position should be gradual, increased physical activity, and in the event that this does not give adequate results, then medicines are recommended. In the case of secondary hypertension, treatment is carried out according to the origin. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedyland. Take care.